Thank you very much for the opportunity to talk with you today. I'm very sorry that I was unable to join you in person, especially since I wanted to hear the panel presentations about developments in science that affect early learning. Science has been a tremendous driver of policy in Washington State and continues to be. And I think it has great promise for changing our policies around parents and young children. Science really started our engagement with early learning about 5 years ago when Dr. Pat Kuhl, who's a co-director of the Institute for Learning and Brain Sciences, came to the Appropriations Committee and gave a presentation on her research on the development of infants and their understanding of language and how they develop language. It was a spellbinding presentation that really demonstrated to legislators the link between those first few years and the learning that takes place and success in school later in life, and has sparked our drive to really address the needs of young children, because we know that is the best thing we can do for academic achievement. That seed that was planted by Dr. Kuhl really sprouted when Dr. Shonkoff came to Washington and to Olympia to work with us on getting a bill passed to create an early learning council. And Jack met with legislators, presented to a Senate hearing, met with the governor, and all of that resulted in the passage of legislation. But as important, he also met with the policy directors in Washington, the Secretary of the Department of Social and Health Services, and staff from Department of Health and from our child welfare and TANF agencies. As a result of that, we really focused on the needs of very at-risk young children and changed our policy so that public health nurses and our TANF caseworkers could refer children to therapeutic child care, not just our child welfare caseworkers. It's an example of how we can holistically look at the needs of children if we pay attention to the science. We have steadily built on that base over the past few years and have built a very strong policy foundation for early learning. We created a Department of Early Learning and funded a quality rating and improvement system, the development of a system. Unfortunately, in one of the first rounds of the many budget cuts we've had, funding for QRIS was eliminated. So we have established the foundation and the framework for a system to improve the quality of child care, but we don't have the funding to build the house. 2 years ago, we passed a bill to create an evidence-based and research-based home visiting program across the state. And that, again, has been very successful and is producing good results. It focuses on the highest risk families and is voluntary, but it only reaches 2% of the eligible families. With private funding through our public-private partnership, Thrive by 5, we are going to expand that program a very small amount this year, but we're very excited about the funding in the healthcare reform bill, which will enable us to reach many more families in the years ahead, and we really look forward to receiving guidance about how we can build that program. I'm very proud of one bill we passed this session, which I think best reflects the priority that this legislature has established for young children. We passed an entitlement for our state-funded early childhood education program for 3- and 4-year-olds. The entitlement won't be fully implemented for 8 years, but it clearly establishes that we want to serve all eligible 3- and 4-year-olds who are low income, and we will build to that as we are able to do so. It's one of the best reflections of how much we have learned about the importance of preschool for the success of children when they get to kindergarten. We're also working very hard to redirect existing programs so that they better serve the needs of young children. One of the issues we addressed this session was the stability of childcare for children enrolled in TANF. Currently, eligibility for TANF childcare is only 3 or 6 months. So when a parent loses their job or leaves school, the child is pulled out of childcare. and then when the parent gets a job, the child is put back generally into a different child care. We know from the research how important stability is for children and those relationships that they develop with their caretakers. So we created a year eligibility for children who are receiving TANF childcare and are also in Head Start or ECAP. We are unable to adopt this policy for all children receiving TANF childcare because of the cost. But I'm very hopeful that we will be able to demonstrate with this small pilot that providing stability and longer-term eligibility will really benefit children and families. Probably the area of greatest promise and greatest frustration is child welfare. We and many other states have been working to reduce foster care caseloads by investing in evidence-based and innovative strategies to work with families with young children to keep them out of foster care, to help parents learn the skills of responding and reading their baby's cues, of really developing a bond that will help them parent that child successfully. Unfortunately, when children don't go into foster care, we lose our federal funding. So as we are successful in reducing our caseloads, we lose the federal funding that to reinvest in the front end and in strategies that really help families. States and jurisdictions used to be able to apply for 4E waivers, which gave them the flexibility as they obtained savings from reduced caseloads to reinvest in the front end. It gave flexibility to the states, and that has produced tremendous results in many jurisdictions. Unfortunately, the 4E waiver authority expired in 2006. So now states like Washington, who are very anxious to invest in effective targeted strategies for supporting these highest risk families, we can't do it without losing our federal funding. So it's a huge disincentive. It's a policy that needs to be changed, and I'm very hopeful that Congress will look at reauthorizing the 4E waiver. Finally, I couldn't end this conversation without talking about TANF. TANF is the safety net for families with children, and our TANF resources are stretched way too thin. We currently face over a $100 million shortfall that we're struggling with in the budget we're trying to finish now. I'm aware that in the House a bill was passed a few weeks ago that would provide $2.5 billion in emergency TANF funds to help states that are struggling to serve these families in this tremendous economic crisis. I just encourage the Senate to address this bill and to provide the resources for states so we do not have to make drastic cuts in our services for these very vulnerable families. Science can and should guide our policymaking in the states and at the federal level. In Washington, we have really focused on targeted, effective strategies for addressing the needs of children who are birth to 5. We think that this investment will provide the best payoff of any investment of our state resources and really encourage Congress and other states to invest in young children so that they have the best opportunity to succeed. Thank you very much.